Hi, my name is Citlali Irales. Some of you know me as Lolly. I decided to cover osteogenesis imperfecta for my discussion on Module 4, mainly because I'm very interested in rare disorders. So an introduction to osteogenesis imperfecta. Osteogenesis imperfecta is also known as brittle bone disease. This is a genetic disorder that impacts the musculoskeletal system. It's caused by a defect in type 1 collagen synthesis or processing, leading to fragile bones. It can be passed down by one parent in the form of a defective gene. However, in about 25% of cases, osteogenesis imperfecta occurs as a new mutation with no prior family history. So there's different types of osteogenesis imperfecta that can go from mild to severe and sometimes lethal. So the first type of osteogenesis imperfecta is type 1. This is the most common and mildest form. Bones are prone to fractures, especially before puberty. However, they do have a more normal to near normal stature, meaning that their height isn't as affected. Collagen structure is normal but produced in reduced quantities. Type 4 is the next one up on the scale of severity. So this one is more moderate to severe. It falls between type 1 and type 3 in severity. So fractures occur frequently, often before puberty. And then some features include shorter than average stature and mild to moderate bone deformity. Type 3 goes up the scale of severity, so this is a more severe and progressive form. It's categorized by severe progressive bone deformity. Fractures are often present at birth and sometimes in infancy. Some features include shorter stature, barrel-shaped rib cage, and possible respiratory problems. And then collagen production is quantitatively defective. Last type that we're going to be covering is type 2. This is known as a perinatal lethal form. It is the most severe form. It's often fatal at or shortly after birth due to respiratory complications. There's severe form deformalities and multiple fractures, which are evident at birth, and they usually present with underdeveloped lungs and improperly formed collagen. So more common signs and symptoms in all types of osteogenesis imperfecta can include dentinogenesis imperfecta, which you can see here in the teeth. This is usually like amber, brown, or bluish tinted teeth. Blue, purple, or gray in the whites of the eye. And then weak bones that lead to frequent or multiple fractures, and then loose joints. They also present with bowed extremities in some cases. And then some other possible signs or symptoms include hearing loss, short statured, as we saw through some of the different types in the previous slide, muscle weakness, and spine curvatures, depending obviously on the type of osteogenesis imperfecta that the patient presents with. So diagnosing osteogenesis imperfecta can be diagnosed via clinical evaluation and family history. Genetic testing and collagen analysis are used to confirm the diagnosis. So treatments. Medications. So bisphosphonates are given to help improve bone density and reduce fracture risk in some cases. Medical interventions, intramedullary rod placement depending on the severity of the deformities, and then lifestyle. So some patients might require physical therapy, mobility aids such as wheelchairs or walkers, and obviously avoiding high-risk activities due to their brittle bones. Osteogenesis imperfecta or abuse. It's been estimated that roughly 7% of children with signs suggesting abuse have an underlying medical condition that can account for those signs. So osteogenesis imperfecta is commonly misdiagnosed as child abuse due to unexplained fractures. So the risk of osteogenesis imperfecta being misdiagnosed as child abuse disproportionately affects marginalized families. Some key differences that help move away from abuse misdiagnosing includes lack of bruises, spontaneous fractures, and family history. However, osteogenesis imperfecta can be harder for families with no prior family history, especially due to it being such a rare disorder that not many know about. Improving identification of osteogenesis imperfecta can possibly include developing standardized protocols for distinguishing between osteogenesis imperfecta from abuse, and then maybe also promoting the use of genetic or collagen testing in suspicious cases. And then here are my references. I hope I was able to provide you guys some information that you didn't know about this disorder. Thank you.